Good day. Now I'm going to perform per-oral or PO medication administration. The first thing that we are going to do is we're going to assess contraindications of the client receiving oral medication. Ma'am, makatulong na ba taog ka ng tablitas, ma'am? Makatulong na. Wala ra ta naka-experience o matagkasukaon ta, ma'am? Or malipong? Wala. Wala ba ta na-diagnose before? Katong before pa dyan, wala na-diagnose na natay bowel inflammation? Wala ra, ma'am. Papapunta ka sulay o GI surgery, ma'am? Wala pa po. Okay. Sige. So, if you are in doubt, you can check whether the client can swallow. You can ask her to cough or check the gag reflex. So, since we have already made sure that our client is able to swallow, we are going to proceed. Next is we are going to assess client's medical history, history of allergies and medication history and diet history. Then next is we are going to gather physical examination and laboratory data that may influence medication administration. Then we are going to assess our client's knowledge with her health, and of course the medication use. So, ma'am, karon ma'am, naay gi-order ang atuang doktor nga ipatumar nimo nga tambal karon. So aware man ta og na unsa ta ma'am no anong pakunon ta ni doc og ingani nga tambal. Okay, so since ihilantan man ta nya taas pa jud ang atuang systolic rate upa natay na ipainom si doc nato. So makatulon raman ka og kuan ma'am no, makatulon raman ka og sa ito ganing tambal. Ato na lang ng kuanan og tubig para mas dali ra nimo matulon ha. Sige. So we are going to wash our hands and then prepare necessary equipment. So since we are not going to touch our medications from bare hands, we're going to use gloves. Now we are going to prepare medication one client at a time. So we are going to select the correct medication and then compare the labels from the container and of course from the medication ticket. Okay, so as necessary, we are going to calculate the dosage of every medication, or we are going to double check out the calculation. So since I have already calculated or double checked the calculation of the medication, now we are going to proceed to the preparing the tablets. So to prepare the tablets or capsules from stock bottles, we are going to pour enough medication to the medication cup and then transfer medication to the medication cup. So the extra medication should be returned through the bottle. So we also need to take note that medication that needs to be broken should be broken using a gloved hand, or medication that needs to be broken are pre-scored. The pre-scored is very visible in the medicine since it is manufactured with a line transfers in the center of the tablet. Next is to prepare capsule. We are going to place pack capsule directly into our medicine cup. All medications that our patient that is going to take in should be placed in one medication cup, except for those requiring pre-administration assessment, especially say for example if we're going to take blood pressure or pulse rate of our patient. So since our client is going to take in a tablet that is for her high blood pressure, so we are going to place it on a different cup. So if our client is not able to swallow the medication, we can ask the physician to substitute it with liquid. But if liquid is not an option, then we are going to crush the pill. But you also have to take note that not all medications can be crushed. So when in doubt, we can always ask the pharmacist. So since our patient is able to swallow the pill or the medication, then we are not going to ask our physician to substitute it with liquid. Then with that, we are also going to skip the step in which we are going to prepare the liquids. The next thing that we are going to do is we're going to check the expiration date of our medications one by one. This is because we are going to make sure that each medication has not passed its expiration date, for a reason that it may loses its effectivity, and also it can harm our patient if it has already expired. Okay, so all medication hasn't expired yet. After checking the expiration date of each medication, we are also going to again compare the medication container to the medication ticket to reduce error. So for the unused tablet, we are going to return it to the grower. And then of course we have to make sure that we have also read the labels for the third time. Then you have to make sure that we must not leave medications unattended. So for administering medication, we are going to take the medication to our client at the right time. So may hapon ma'am, unsa ganito pangalan?
Florence Safran.
Okay, Florence. So karon ma may gihatag si Doc nato nga tambal. Nasayod man ta nga maglabad ang ato ang ulo kay tungod sa atong hilanat or taas ato ang temperatura. Dayon anang taas po ang ato ang systolic rate. Unang naihatag si Doc nato nga tambal. Wala ra ba tay pangutanan sa atong mga tambal ma'am? Wala. Sige. Lingkod ra ta ma'am para karon nato ang tambal. Then now we are going to administer the medication. Kung sa tagkamot, ma'am. Sige, na itong painom, ma'am, kaning tambat para sa imuhang hilana. Natulo na, ma'am. Nga daw. ato ning ibutang ilalom sa ato ang dila ha, dili nato ni usapon ug dili po nato ni tunlon ato ning palanayon. Sige. Yes, dili yan. Ilalom sa dila. Nalanay na ma'am. Nalanay na. Aning last na to nga tambal ma'am. Sige ko aning kasama. Ana siya ibutang sa kilid sa imong hanggangs. Ana diha. O dili gyapon nato na tunlon ha, dili pud usapon. Kinalanay na ma'am. So, if client is unable to hold the medication, we can always offer the medication in such ways that we are going to place the medication cup closely to her mouth and then introduce the medication one at a time, and we should not rush the patient, especially for those medication that requires to be dissolved in the mouth of our patient. And then if it happens that the capsule fell on the floor, then we are going to replace it with a new one. And of course, we are going to stay with our client until the medication has been swallowed or the medication has been dissolved. So when in doubt, we can always check the mouth of our client. So, pangang ganita ma'am. So at this time, the medication has been dissolved. So we are going to move on the next step. We should also take note that if we have offered our client highly acidic medication, then we are going to offer non-fat snacks, say for example crackers, and of course it should not be contraindicated. Then we are going to proceed to having our client into a comfortable position to restore comfort. After having our client into a comfortable position, we are going to dispose soiled materials and or supplies and wash hands. Then after 30 minutes, we are going to return to our client to check for any response with the medication. Um, let's just assume that it has already been 30 minutes, so we have returned to our client to check for any response with the medication. Okay, so may ngapon ma'am, ano yan na po karon ma'am kaya atong i-check if naabay response ang imuhang lawas sa katuang tambal nga atong gitumar ganiha. So karon ma'am, wala pa man gihapon ni ubos ang ato ang hilana, ato ning ingot dire. Ugas na pud ang ato ang systolic rate. So sige. Mangutanon ka na ako ma'am ha. Ako ni iingon tanan ug sa tong mga tambal nga atong giinom, ug unsa po ning oras sa nato imnon ug kapila nato ni siya imnon sa usa ka adlaw. Sige, so para sa katong imong hilanat ma'am, gitagaan ta ni Doc og Biogestic nga imnon nato kaupat sa usa ka adlaw. Imnon nato ni alas 6 sa buntag. Diba ni ma'am ha? Alas 6 sa buntag, alas 10 sa buntag, alas 2 sa hapon ug alas 6 sa gabi. So gitagaan po ta ni Doc og captopril nga imnon nato ni kaduha sa usa ka adlaw. Imnon nato ni alas 8 sa buntag ug alas 8 sa gabi. Kani pong Bonavil po gihatag ni Doc 4 to 6 hours ang dinote ni Doc. So nag-inom man ta og alas 7. So posible nato ning imnon alas 11 or alauna sa hapon. Sige, natimanan dato ma'am sa ganito mga tambal nga gihatag ni Doc ma para sa hilanat. O then ang sunod captopril. Then ang sunod Bonavil. Sige. Okay. Then we are going to notify our physician if our client exhibits toxic effect or allergic reaction with the medication we have given, so that we will withhold any further doses. And of course, for the recording and reporting, we are going to record administration of medications on patient's chart. Then place our initial or signatures on medication sheet opposite to the time it was administered. So since I have mentioned earlier that if there are any allergic reactions to our client with the medication, we are going to note it, we are going to record the reason if the drug is withheld, and we are going to follow agency's policies for proper recording. So maura to ma'am ha, thank you kayo sa imong kooperasyon.